Welcome back to Ask the Educator, a podcast for all professionals involved in medical device processing and sponsored by Healthmark Industries. The education team here at Healthmark has 280 years of combined experience in areas ranging from sterile processing, endoscopy, OR, biomed, to hospital and industry leadership. Our goal is to leverage our collective experience to answer one of your questions each episode, giving you the practical tips you need to succeed in the evolving world of device processing. My name is Kevin Anderson, clinical educator here at Healthmark, and I will be your host. Let's get started. Hello, everyone. Welcome back to Ask the Educator. This is Kevin Anderson, your host. With me this time for this episode is Cheron. We had a earlier episode. It was number 33, and Cheron and Seth and I, we were discussing insulation testing. And that one we talked about, what did they need to know about insulation testing? We also had a podcast recently in which we announced the publication of 4 amendments to the ANSI AAMI ST79 standards for steam sterilization. And so in this episode, I thought I'd bring Cheron back and we would speak more in depth to that second of the 4 amendments that deals specifically with insulation testing. So Cheron, welcome back. Glad to have you as always.
Thank you, Kevin. It's good to be back.
All right, Cheron. So there are 2 new sections added to ST79 with this new amendment. Can you briefly explain what the first section is about?
So overall, the 2 sections make up 6 pages. So I just wanted to let you know, let the users know that. And in the first section, it's 8.2, which is really the inspection of instruments and devices of all categories. So I wouldn't say it's a vague statement, but it's basically addressing all the different types of things that you need to consider and what is out there for the inspection of those type of instrument devices. So basically it starts off is each time a medical device is processed, right? So it's not once a week, once a month, it's none of that. It's each time the medical device is processed. It also goes into visually checking for cleanliness and integrity. Also addresses enhanced inspection with magnification, as well as the borescopes for that cleanliness and integrity may be used with borescopes. And then it also goes into following the IFU of the instrument or device, specifically for the borescopes. So if the instrument device calls for that, as well as the manufacturer IFU of the borescope itself. And then it also ends with that with IFU should be followed. So kind of like that intro.
Yeah, excellent. And like you said, it's 8.2 is pretty short and to the point, and it's more general. I like that you mentioned that. And then obviously 8.2.1 is much longer. So I think it's a good idea to get into that second part, 8.2.1. So Cheron, if you could just kind of give us a brief overview about this section as we go forward.
Yes. So this section is really getting into basically the inspection of instruments that have the electric current. So in English, it's basically all the insulated devices that electrical current would pass through. This is the majority of the amendment, and it really goes into detail, I got to say, of all these different categories of instruments and all the inspection points. But in the first section of 8.2.1, it just goes into which I really like, because it talks about how instruments should be organized and protected, and that they should be, right? And because usually in my travels, I see a lot of instrument trays that are mixed. So you have metal instruments against insulated devices, and they're just getting damaged. And then, of course, the finger pointing starts, right, between OR and SPD sometimes. But actually, it just comes down to the right container. So I do like that they start off pretty strong about protecting. And then it goes into that the insulation should be inspected using lighted magnification as well. And then goes into the different categories of those instruments.
So you mentioned the categories. I think when we, anybody who's worked in surgery or SPD, we automatically think, okay, laparoscopic instruments, this is the one we know, like right off the top of our head, that is, going to jump out at us when we talk insulated instruments. But you made a good point. There are a lot of different types of instruments that they're covering here in this amendment. And so would you mind just sharing all the different types that we may or may not think of right away when we think of insulated instruments?
Well, I definitely have to start off by saying I'd love to, because in my travels, a lot of people focus on just the laparoscopic category, and it's very consistent across the country. So I'd love to break down the categories. So in the laparoscopic category, and there's a really nice table that goes over all of these categories as well as some other sections, which we'll talk about in a bit. Laparoscopic is the first one, but it states laparoscopic including robotic. That's the first one. Then it goes into forceps, scissors, leap, and then it also goes into the reusable electrical cords and cables, miscellaneous, which would be like your coated vaginal speculums. So again, it's addressing all the different types of insulated devices.
Yeah, I think that's a great point. And I'm glad that you mentioned the table. I think it's a great resource for people. And I love that they're bringing that into this, because so often, you're reading your standards and guidelines and things like that. And unfortunately, with them having to be somewhat general, a lot of times it's hard to pinpoint where all of these things are going to apply. So I really like the table. It's a great visual, and it also gives guidance as to like what we're going to do in terms of inspection and the inspection points as well. And so what kinds of things do you see in that table that really stand out to you when it comes to this inspection of all these various types of instruments?
So there's 4 columns in this table, and it goes down to each category, but the columns would be the category itself, the inspection points, the possible damage for that type of instrument in those inspection points. And then the last one, which is the methods to assist with inspecting or testing. So that was probably the most, I would say the more detailed section was the possible damage, and then the methods to assist in those areas. The methods to assist in inspection, each one of those boxes for those categories goes over visual inspection, tactile inspection, which would be feel. You need to also feel the instrument itself, installation tester for all of these categories, lighted magnification, and then enhanced magnification microscope. Again, that's a lot, for each category. If you ask someone out there, they may maybe only list like 1 or 2, but as you can see, there's a handful.
Yeah, absolutely. And one that you mentioned that stands out to me in terms of type of instrument or whatever that needs to be inspected is the cables and cords. Oh my gosh. It's funny because we use these things so frequently with doing lap chole procedures or whatever, and they seem like such a benign instrument. But the reality is, and I think I mentioned this in our insulation testing episode, those things can cause problems in the OR. They can spark, they can potentially cause a fire. So now they're giving us guidance and saying that these cables and cords are also a source of concern, and they need to be inspected and checked for integrity and continuity, which is interesting. The difference between insulation integrity and continuity. Can you explain that one? I know I kind of spring in this one onto you, but
That's okay.
But I think it's really important.
Yeah, no, it's a good one. And I'm glad you are springing this on me, because the integrity is really about the outside. So if I was to really break this down, and that would be an insulation tester and using the right accessory to be able to test that cord on the outside. Sometimes you can see it without a tester. You can see visually or enhanced inspection that there's a break. But the continuity is a little bit different, because the continuity is basically, it's measuring the resistance between the 2 points from proximal to distal. So this is another type of equipment that you would test. This is not an insulation tester. This is a different type of equipment that's testing that electrical flow inside that cable or cord, basically making sure it's connected. So even though using enhanced inspection or insulation tester on the outside, it could pass that, but it doesn't mean it's working. So understand that, I ran into it as a scrub, and you probably have, Kevin, yourself, where the cable looked fine, and then I'm, hooking it up and everything, it doesn't do anything, So that tells me that the continuity is, there's something wrong with that. So just understand those are 2 separate tests with it. And I'm actually currently working on an article that when I was looking at some mod reports for the FDA, there was actually a fire linked to the cable sparking and catching the drape on fire. And this was in 2020, last year in September, I believe. So it's a big issue, and this is something to be concerned about.
Yeah, absolutely. The wear and tear. And then, I think there's some IFUs out there that prescribe how many times it can be processed, whereas some of them don't give you that. I remember having a cable where it said you should get at least 100 uses out of it, but it had no limitation as to how many times you could process it, which is kind of scary in a way, because in that sense, it could go on forever according to that thing. And so we all know how IFUs, we need to be cognizant of those and what they're saying. So this is kind of nice that at least now we have some guidance and we have the tools we need to actually inspect for insulation and the continuity of those cords and make sure they're safe. I know one of the things you mentioned in the OR, how it may not even work. I know sometimes the docs just crank up the power on these things. And then, there's probably some arcing going on in there because the continuity is not there. So real important stuff. So along those lines, we're doing all this testing. What should people do if an instrument fails one of these inspection points, whether it's visual or an insulation test or whatever? This is another part that's in this amendment. So what should we do when this happens?
So great question. So when you find it, you definitely want to set it aside or put it through a repair process or a task, depending on your facility's policy procedure. What that doesn't mean, it doesn't mean you put it back on your backup wall or your backup drawers, which I do see again across the country. They go into a specific bin. I do want to stress that, you shouldn't have one bin that catches all. You should have numerous bins for repairs that separate heavy from power to insulated devices to sharp like skin hooks and such, because even though you find one break and you send it for repair, you could actually be damaging that instrument multiple times different ways because you're just putting it in one bin. So I just want to add that. But again, looking at your policy procedure, one for evaluation of what that consists of, and using AAMI as obviously as that recommendation, and then looking at a process for repair of separation, and then going out, and then also coming back in, because when it goes out for repair, you also need to check it at certain points as well to make sure that it was repaired correctly. I didn't mention in the beginning, and under the 8.2 in the very beginning session, also addresses that when you purchase new instruments. So I know we're talking about repair, but I just want to add that when you purchase new instruments, all the inspection equipment should be present and available prior to its first use. So it's not just about cleaning it, which we all know that the instruments should be cleaned before they're in use, but also inspection. So I wanted to add that.
Oh, I'm so glad you brought that up, because it's so funny that it's like one sentence within a very small section that's added in this amendment. And yet it's so important, because I think we oftentimes are asked to go ahead and purchase something for a physician or replace items and things like that. Or you have a new physician that you're onboarding and you got a whole laundry list of things you're going to buy. And that's one of those steps that I think often gets disregarded or forgotten about is, all right, how are we setting ourselves up to be able to process these things? Because we check them off in our mind. Oh, that's laparoscopic. Oh, that's whatever. But the IFUs are changing. The standards are changing. Right. Do we have what we need in our department today to process these devices? So great point there. I'm glad you brought that up. And, of course, here we are. We're running out of time. This is like one of our big amendments that I definitely recommend you get into and you really try and unpack every single sentence, because you're going to find stuff like that. So, Cheron, before we end this episode, just, do you have any favorite last points that you really want to touch on before we end?
Yeah. Oh, yes, I do. So, I do get asked the question, especially after the amendment came out, of, well, how do I know if I have the right test or accessories, or do I need to buy a new one? Or can I keep my old one, or whatever? So really my answer to everyone as a user is you really need to evaluate it based on your inventory of your instruments. So if you're a surgery center and all you do is laparoscopic insulated devices, that's all you do, that's your whole inventory, you have nothing else, then the insulation tester you have might work if the accessories only test for that. But if you're a facility that deals with plastics, neuro, orthopedics, whatever, and it's going to be forceps and scissors and cables and all that, you really need to evaluate whether you have the right tester for that, and then looking at a tester that has all those different accessories to do that. Or you may have a tester that just doesn't have all the accessories for it. So you just need to contact your vendor of your installation tester and purchase the additional accessories to do so. If you don't have, or if you have the right accessories to do so, but maybe they're more cumbersome to use, then you're not going to get the compliance from your frontline team. So I also want to address that as well, that you need to look at accessories and testers that are easy to use.
Excellent. Thank you, Cheron. And unfortunately, that is all we have time for, but I think he ended with a great point there that also leads into the training aspect of things. So with these insulation testers, the continuity testers, make sure that you guys are getting the training you need for your staff and getting them competent on these new inspection points and new pieces of equipment that you're sure to need going forward after these amendments have been released. Thanks again, Cheron. I really appreciate you being on the show as always.
Thank you, Kevin.
All right, that wraps up our interview with Cheron Rojo of the Healthmark Clinical Affairs team. Just to recap this episode, Cheron and I discussed the changes that are upon us now with the newly released amendments to the ANSI AAMI ST79 guideline for steam sterilization. So here are just a few of the main points that are a part of the second amendment that just came out. Each time a device is processed, it should be inspected for cleanliness and integrity. To do this, it may require cleaning verification, magnification, bore scopes, or maybe other equipment. Inspection equipment should be purchased and available prior to the first use of a reusable medical device. Also, instruments should be organized and protected from damage. Instruments intended to be used with electrical current should be tested for integrity each time it is processed. Amendment 2 also provides a useful table and pictures to help users better understand inspection points, potential damage, and methods for inspection. There is a lot of information in this one amendment, so I encourage you all to get your copy of these amendments and go through it for yourself for better understanding. Please tune in next time when Seth Hendy and I discuss all the other recently released amendments. And please contact us if you have any questions at our email address at asktheeducator@hmark.com. Thanks for listening. All opinions expressed on this show are those of the presenters. Before using any medical device, it is important to review the device manufacturer's instructions for use.